resume his seat. The member for Barker has the call. Member for Barker has the call.
Thank you, Mr Speaker. Mr Speaker, my question is to the Minister for Health and Sport. Will the minister outline to the House why energy security is crucial to providing reliable healthcare for Australian families? Is the minister aware of any examples where an unreliable energy supply has put the delivery of critical healthcare services at risk?
The member for Health and Sport.
Thank you very much, Mr Speaker. And I want to thank the member for Barker, who knows that energy security is fundamental to the provision of safety and patient care in our healthcare services and our hospitals. I know myself. I warned on August 17, when I was in South Australia, of the serious and significant risks to their infrastructure from energy security from the South Australian experiment, which the Leader of the Opposition wants to adopt nationally. We know, however, that this has translated to real and significant consequences for the South Australian healthcare system. On February the 8th, during the most recent round of blackouts, what we saw in Millicent and Penola and Murray Bridge and Mount Gambier was that those hospitals were all forced onto backup generators. Those hospitals were all forced onto backup generators. Quite significantly, the South Australian Energy Minister at the time tried to say that critical infrastructure such as hospitals would be exempt from load shedding. It was then up to a South Australian government official to correct it and make the small correction that smaller hospitals and healthcare facilities across South Australia may be affected from time to time. Right. Well, they were. And so 4 significant hospitals and facilities, including the state's largest regional hospital, were forced onto generators. But generators, of course, may not always work in a time of crisis. We saw that on the 28th September blackout. Remember the blackout that was just a hiccup, according to the member for Port Adelaide? On that day, the Flinders Medical Centre generator failed. What was the consequence of that failure? Embryos waiting to be transferred to a fertility clinic were destroyed as a consequence of that blackout. If there are any members on that side that thinks that that is a hiccup, funny or trivial for those involved, now is your chance to speak up. But it wasn't just Flinders. It was also Port Augusta, where for 5 hours that day the backup generator failed. So the importance of energy security to healthcare is absolutely fundamental, as not just us, but as the South Australian HSU itself said. You remember the HSU, your good friend Craig, to the Leader of the Opposition. What the HSU said is much equipment runs on power. You have oxygen machines, machines taking blood pressure and breathing apparatus that are run by power. There could not be a clearer statement from no less than the HSU why energy security in South Australia is so fundamental to healthcare. They've blown it up at the state level. The Leader of the Opposition wants to do the same at the federal level. He should protect our